How are Medicare out-of-pocket limits calculated? Imagine reaching a point where your healthcare costs for the year are fully covered, and you no longer have to worry about co-payments or co-insurance. That's what out-of-pocket limits aim to provide. But how exactly are these limits figured out? Let's break it down in simple terms. First, it's important to know that Original Medicare, which includes Part A and Part B, does not have a set annual out-of-pocket maximum. You could end up paying a lot depending on your healthcare needs. But for Medicare Advantage plans, which are an alternative to Original Medicare, there is a maximum amount you will pay each year. These plans are required to set a cap on your out-of-pocket expenses for covered services. The federal government determines this maximum limit each year. They look at healthcare cost trends and how much health insurance costs are increasing. The calculation considers how much more people are paying for health insurance over a baseline year. The limit is then adjusted upward based on the percentage increase in premiums since that year. The final figure is rounded to the nearest $50. This way, the limit stays in line with rising healthcare costs. For Medicare Part D prescription drug plans, the calculation uses what's called the True Out-of-Pocket Costs, or TROOP. This includes the money you pay directly for your medications, like deductibles, co-payments, and co-insurance. Payments made by supplemental insurance plans on your behalf do not count toward this limit. Once your TROOP costs reach a certain amount, you enter the catastrophic coverage phase. At this stage, Medicare covers most of your drug costs, which can significantly lower your expenses. It's also worth noting what doesn't count toward these limits. Premiums you pay for Medicare Parts A, B, or D are not included. This means your monthly payments are separate from the out-of-pocket maximum. In Original Medicare, there is no cap, so your costs can add up if you need a lot of care. But if you have a Medicare Advantage plan or a Part D plan, knowing how these limits are calculated can help you plan better. Tracking your spending on co-payments, co-insurance, and deductibles is key. Once you hit the limit, your plan covers 100% of covered services for the rest of the year. This makes managing your healthcare costs more predictable and less stressful. So, understanding how these limits are calculated helps you stay on top of your expenses and know when full coverage kicks in.